COVID vaccines. I'm Chana Davis, a geneticist and contributor at Those Nerdy Girls, and I'm joined by fellow nerdy girls Andrea Harmony and Gayle Mendoza. Today we're going to be drilling into areas where we've gotten lots of questions, mostly relating to which vaccine to get and when to get it. This is a follow-up to last month's Q&A where we answered a lot of other questions about this year's updated shot. So I encourage checking that out if your question wasn't covered here today. So Andrea and Gayle, before we jump in, can you briefly introduce yourselves?
I'm a nurse practitioner and public health professional and contributing writing for Those Nerdy Girls.
Thank you. And hi, everyone. I'm Gayle Mendoza. I use she, her pronouns. I'm also a public health professional, a registered nurse, and a contributing writer for Those Nerdy Girls.
So awesome to have you here. Gayle, this is the first time we've chatted face-to-face, so this is a great opportunity for me to get to know some of my fellow nerds.
It is, yeah. No, thank you so much for having us, Chana. I'm excited.
So the first topic we're going to dig into is vaccine reactions, because I think this is something a lot of people worry about. And so the general theme here is, if I'm worried about having a bad vaccine reaction, what can I do? Andrea, one specific question we have on this is, I had the Pfizer vaccine in the past. I had a reaction, swollen lymph nodes for a few months after a shingles vaccine. That's got this person worried about vaccine reactions overall. So I feel like Novavax is the safer option for the booster, but should I stick with Pfizer? I feel like I have an odd, unknown vaccine allergy, and I'm always nervous about choosing vaccines. That's from Pam in Houston. So Andrea, what would you tell Pam?
Sure. Thanks for the question, Pam. We don't really know why some people seem to get their shots and are fine the next day, while others might be tired, achy, or even have to take a day or two off work. We do know that mRNA vaccines, so Pfizer and Moderna, are more reactogenic. And that means they tend to cause more of those mild but really annoying side effects than other vaccines. If you had one brand in the past, you said you had Pfizer, certainly find a mix and match. And there may even be some benefits of it. Chana's going to talk a little bit about that later. As far as side effects, we've heard a lot of kind of people saying, yeah, I got Novavax. I don't have as many side effects. And we have studies to support this now. They show that not only there's more of the people that get Novavax have the side effects, but of both vaccines, people get Pfizer, people get mRNA, people get Novavax. The people that have the side effects, people that get Novavax actually have less of the side effects. So if you had some unpleasant side effects with mRNA from the past, Novavax is certainly a reasonable choice. Myself, I got Novavax this year. I've had the other ones. I figured, why not? But I can't say for sure how I felt because my kids kept me up all night and I was tired the next day. So who knows?
Yeah, whenever I looked at these side effect studies, it's actually always shocking to see how many side effects we see in the placebo group. And a lot of us, especially parents, just don't feel great a lot of the time. And there's a lot of other factors at play. So we can't even always attribute what we think is a vaccine side effect to the vaccine.
Right.
So another question relating to this from Victoria in Cleveland. She asked, is the new COVID vaccine similar to the last one with a potential warning to someone with heart issues, specifically AFib? My partner had a bad episode after last year's vaccine and now doesn't want to get a new one, but I'm worried he'll get COVID, and he's 80.
Yeah, my parents are 80 and I would be worried if they got COVID as well. And when this person says AFib, they mean atrial fibrillation. It's a heart arrhythmia when the rhythm gets messed up. There's no association between COVID-19 vaccination and AFib. AFib is the most common heart arrhythmia in patients with COVID-19, actually. It's also really common in older adults, and it's more common as you get older. The only real reasons not to get a COVID-19 vaccine, and the word we use for that is contraindication, true contraindication. The only reason you shouldn't get one is current infection, so you don't get other people sick, or a recent multi-inflammatory syndrome, or MIS. MIS is a serious condition that leads to hospitalization, sometimes even death, happens in both adults and children. As the name implies, more than one body system is affected, and it's caused by COVID-19 illness, not COVID-19 vaccination. There can be allergic reactions, rarely, but this is not an absolute contraindication, meaning the vaccine can still be given in some cases. People who've had a history of severe allergic reactions should talk to an allergy specialist because sometimes there are some things they can do so that you can still get the shot. Of course, we're talking about heart disease here, and when we talk about vaccines, we always think about, or at least recently think about myocarditis and pericarditis. Those are inflammations of the heart. They can happen with other illnesses. They can happen with COVID-19 illness, and rarely they can happen from COVID-19 vaccination. To be clear, these conditions are extremely rare after vaccination, and it's way more common to suffer from this after COVID-19 illness. Not only this, but post-vaccine myocarditis is more mild. It does not last as long, and in a long term, like months later, you see those people with fewer symptoms than people who had either of those conditions from a COVID-19 illness. And the risk of this condition is really in this 12 to 39 age group, more often in males, but we did see it in females. And that happened when we had those shots closer together, when we were giving them a series, 1, 2, 3 shots. There was a 4-week interval. We're not doing that anymore. There's really no reason that age group should need 2 shots, but if they do, we could give it 8 weeks apart. And we're not seeing the rates of myocarditis that we saw before that were very small. We're not even seeing that now that 1 shot a year is recommended.
I feel like we should clarify here, even in the category that where myocarditis is the most likely, it's still more of an issue with the vaccine. With disease. So, let me rewind. Even in the population where that risk of myocarditis from a vaccine is the highest, the risk from the virus is still going to be a greater concern.
Right. And among the other age group, it's not even, wouldn't even be mentioned. Yeah. But among that age group, still very rare off the board. And then even extremely more rare than with illness. Okay.
Thanks for that very detailed answer.
But Gayle's going to talk a little bit more about Novavax. We get a lot of questions about it. A lot of people are wondering, is this better? Should I get it? Kind of similar to the first question.
Yes. So one of the questions that we ended up getting was from Tammy from Wisconsin. And she asked for those of us that have strong side effects from COVID-19 mRNA vaccines, are there any other COVID vaccine options that we should consider that might have weaker side effects, but still offer protection? And so what I would say to Tammy, and thank you so much for your question, is, as Andrea mentioned, right, there is some evidence now that the third type of COVID vaccine, which is Novavax, might result in somebody experiencing less side effects than either one of the mRNA vaccines. In that study, the difference between people experiencing a reaction from Novavax versus an mRNA vaccine, we know those are Moderna and Pfizer, was around 20%. And this is for both local side effects like tenderness or mild swelling at the injection site, or systemic side effects, which affect the whole body, like a fever, feeling really tired, or having body aches. Now, what's important to point out too is that the types of side effects are pretty similar among all 3 vaccines. Rather, it's that more people experience side effects with Moderna or Pfizer compared to Novavax. Because I know sometimes that's a question, right? Are the side effects different from vaccine to vaccine? Mm-hmm. One thing we should also remember is that in practice, really each person is different. So just because a study says that the study participants experience less side effects with Novavax doesn't mean that on a case-by-case basis for a specific person that they would experience less side effects. It could be less, it could be the same amount, you might even feel more crummy, but it's really that these side effects are temporary and they should really only last between 1 to 3 days for those who do experience them. And this is so much better than actually getting sick from COVID, which we know can certainly last longer. That can be several days, just for some people, maybe even a couple weeks out. And then we always know that there's that risk of long COVID as well. So getting vaccinated either way is important. I know the question's also asking about protection, and it's actually really hard to give specifics on whether one vaccine is necessarily more effective than another, as they all really do have similar levels of effectiveness, And truthfully, the immune system is incredibly complex. I am definitely not someone who's an immunologist, and there's so much level of detail here that there's a lot of nuance that we're still trying to understand. So, in part, we have more people who are getting Pfizer and Moderna, but less getting Novavax. So sometimes we don't have those numbers to really compare properly. And then what we do know is that some of the data shows that antibody response is, again, pretty equivalent across all of these three vaccines, and that antibody response gives you that short term protection. But there is also some evidence that shows that mRNA vaccines might provide longer term protection via T cells, which are also part of our immune system. But again, there's so much to tease out in this, and we really need more studies that would directly compare Novavax to other vaccines in order to know more. Ultimately, what I would say is that since all three vaccines really do have that same level of effectiveness, and if you're feeling hesitant about getting another Pfizer or Moderna vaccine because you didn't like how it made you feel, Novavax is certainly another option. And at that point, it really just comes down to finding that provider, that pharmacy, that healthcare facility that offers Novavax. Some facilities might only stock one type of COVID vaccine, so it might take some searching to find a location that has that specific vaccine that you want.
Yeah, just to reiterate what you said, I mean, if you think about the study that you need to do to answer this effectiveness comparison, definitively, you'd need
Mhm.
to have people who had the exact same history, right? Like the vaccination history and infection history, and compare them, over some duration. And it's pretty hard to find two people that have the exact same history at this point.
Right.
Lots of reasons why these studies are really challenging.
Right. And find enough of those people to make those numbers really mean something and be
Mhm,
generalizable. And
mhm.
so, it's a hard thing to do.
Yeah.
Right. I know that, like I said, I got Novavax and I sent my husband to get it, but I had to go to we went to two different pharmacies because, like you said, sometimes you got to try a little harder if you want one or the other. And really, they're very similar in effectiveness and they're all going to be great options.
Yeah, for sure.
But we do have another question about vaccine choice. Joy from Alabama asks, which COVID vaccine is a better choice for people over 70 who may have weakened response to vaccines? mRNA or Novavax when available?
So, Joy, thank you so much for this question. And honestly, it's a really tough one because there, again, isn't any solid evidence that gives us this answer. In part because we just don't have as many people getting Novavax. We're looking for a very specific population, which is 70 and older, who are also immunocompromised, and trying to compare that to Pfizer or Moderna. But what I will say is that I want to give you my bottom line first, and then we can get into some of the details that might help older adults make that decision. Ultimately, it's just better to get any COVID vaccine than none, as we've been talking about, because it's really important to boost that immune system to protect against severe disease. It's even more important if you're an older adult and you have a weakened immune system, which is typically why somebody would have a weakened response to a vaccine, because you have a higher chance of getting really sick, right? That's a double whammy. And that's more reason to get vaccinated. Some good news we actually just received the other day is that the CDC's Advisory Committee on Immunization Practices just approved a second COVID vaccine dose 6 months after your first updated dose for this fall season, specifically for adults who are 65 and older and for those who have a moderately or severely weakened immune system. This is great news because it shows that they're trying to reflect what some of that data is currently showing now, which is that last year's vaccine wasn't as effective at preventing hospitalizations in those with weakened immune systems if it's been 6 months or more since their last dose. So, having that option for another dose for these higher risk populations, as well as even additional doses beyond just those two for those with weakened immune systems, that's another option, another flexible option, really means that we're going to keep these populations as protected as possible for as long as possible throughout the year, not just during the fall and winter season. The one other thing that I will say, if you're trying to decide, would one vaccine be better than the other, is that we know that all three vaccines were updated this fall to more closely match those circulating strains. So this means the JN1 lineage of the virus, and it's still all part of the Omicron tree. But after JN1, there was actually another offshoot that's called KP2. I know these are a lot of letters and numbers I'm throwing at you, but hopefully this provides some more insight into this. But KP2 started causing more of the COVID cases after JN1. Again, it's all still part of the same lineage, all still part of Omicron, but the desire is to try to create a vaccine that more closely matches these circulating strains in the time frame that we can. Because of the quick turnaround in mRNA technology and because of FDA's recommendation, Moderna and Pfizer are able to further update their vaccines to specifically target KP2. Novavax, on the other hand, it's a protein-based vaccine, and unfortunately, it just takes longer to modify this type of vaccine. They already had a vaccine created with JN1 earlier this year in preparation for the fall. And because of that time frame it takes to reformulate protein-based vaccines, they continued with JN1. So that's a difference that you might hear of, or that you should know, but you won't necessarily hear of upfront. Moderna and Pfizer are based off of KP2. Novavax is based off of KP1. But to be clear, all three vaccines are still great choices. And the current data, again, shows that they effectively build up the immune system to respond to the COVID virus. The last thing I'll say, which I think we've said many times over again, is that Moderna looks like it might cause some people less side effects. So that is something else you could take into account if you're trying to determine, what could be a better vaccine for me if I'm an older adult and I'm immunocompromised.
Sorry, did you just say Moderna? Fewer side effects?
I'm sorry, Novavax. Thank you so much for that question. Novavax. I know, I'm getting myself confused with the vaccine names too, because we keep throwing them all around. No, thank you so much, Chana.
I just wanted to mention, circling back on what you said about the variants, that this, just a shout out to the amazing platform of mRNA, that this is sort of unprecedented to be able to design a vaccine to match something. So the turnaround time is so much quicker with mRNA vaccines. And so I think they offer a lot more hope than we've ever had of having vaccines that are truly matching strains in circulation, just by nature of the way the technology works.
Mm-hmm. And then, on a related note to this too, we also did have some questions about mixing and matching. Chana, do you want to let us know a little bit more about it? Is it helpful to mix and match vaccines?
Yeah, absolutely. A lot of people, including myself early on, and some other nerdy girls, were really excited about mixing and matching. We were all running out to get different, as many as we could of different types, because I think, and from a biological perspective, it makes sense that poking and prodding your immune system in different ways will kind of help cover your bases. So I actually got AstraZeneca first when it was offered in Canada. And then I can't remember if I had Moderna first, Moderna after that, and then Pfizer or vice versa, but I was all happy that I had all three, and some other nerdy girls had, at least that many. But my enthusiasm for mixing and matching has definitely gone down. I don't think it's not unsafe. It's definitely safe. But I think at this point, the advantage of mixing and matching is going to be subtle at best. So yeah, and like we talked about earlier, it's kind of hard to evaluate this, because what you'd really want is two people with matched, prior histories, and then trying something that was similar to what they'd had and something that was different. We did have more studies of this early on, and I think they often did find a slightly better immune response. But I've noticed a few recent studies that mention they also may come with more side effects, because in general, when your immune system is activated, you might feel it. So it's something that I think is not a huge factor at this point. And I mean, you might get a slight benefit, but it's hard to say. It's probably more of a difference in someone who's basically a COVID virgin, and which very few of us are at this point. So I'll drop a couple of links to the studies, but I think the bottom line is it's not going to make a dramatic difference at this point. It might be a slight benefit, but it's probably not worth bending over backwards to seek that out. I haven't mentioned earlier, I am dropping links into the chat, which shows up on some channels, but not all of them. And we'll post some of these references after the fact on the Nerdy Girls website. So those that want to nerd out a bit more and read the actual studies, we will make them available for you. So yeah, that question was from Steve, who gave us a lot of questions on this topic. So we're glad to be able to address some of them. Now, Andrea, I have a question for you. We had, well, I should say, we had a lot of questions about vaccine timing. And so the general theme is, when's the best time to get my shot? If, and we have, various situations here. So first one, Rebecca from Philadelphia, she asked, how long after having COVID should I wait to get a flu shot in order to let my immune system build strength?
Okay, well, thank you, Rebecca. Maybe I'll see you at the Whole Foods as we live in Philadelphia. I can tell you more about it. Just interrupt me. But as far as timing two vaccines together, there's no scientific or evidence-based reason to space them out. Our immune systems respond well to each vaccine, whether we get another vaccine at the same time or we're getting one at a time. I think you should choose to get vaccines together or apart based on convenience or comfort. Some people like to get the side effects over with all at once. Other people like to spread them out because they feel like maybe they're not hit as hard. Mm-hmm. Some people only want to make one appointment, etc. There's really no wrong answer. I think you do what works best for you.
Mm-hmm. Yeah, we've had a few nerdy girls writing about that and trying out different things, and I think a lot of us are maybe drawn to the convenience of getting them at once, but then if you get hit really hard by that, you're like, maybe next year I'll spread it out. I've seen a few people go try it and then say, that's a bit much. Maybe
Yeah, I can definitely attest to that. Andrea knows that I ended up getting those two vaccines at the same time. I got the flu and COVID vaccine, and I was out for a day and a half. But I gotta say, I honestly would do it again because I know it's one and done. I can survive a day and a half, but I think also that comes with your own particular situation. And I think I'm privileged enough to be able to do that. And I recognize that. And I think I would willingly get them again. And I just know that I got to schedule it during a time when I can lay low, and that's all right to do.
I totally think that's the key. It's the planning for the downtime if you have that luxury.
I made the mistake of getting it on a Friday, which seems like a good idea. But then I was like, instead of just kind of laying low at work, I was like home with the kids, and I was like, oh yeah, I gotta remember to do that better next year.
Yes. When you're a parent of younger children, weekends are when you need your energy most, right?
Mm-hmm.
Yeah, I did a Wednesday, and so I was good by Saturday, thank goodness. So I hear you on that front.
Yeah. So sorry, I lost a little bit about where we got lost in that conversation. So here's another question on that topic. Tammy asked, my husband had COVID and I got a sore throat. I tested negative, but I have a high-risk person at work, so I wanted to be sure. So I swabbed my throat because I remember seeing that can give you a better response. It was positive. And I had a sore throat for 3 days and nothing else positive ever in the nose. And I tested 4 times. Is it safe to say that I had COVID? I was planning on getting vaccinated, so I'd like to delay. I just had it, but I have high-risk parents, so I want to be protected for them. Thoughts?
Yeah, generally those antigen tests, when you get a positive, you're positive. You have to say that the manufacturer is not going to officially, they haven't done enough studies to say like they're going to recommend to do this practice. But, Chana did a great post on it. There is a lot of evidence to suggest that doing both actually increases the sensitivity or the chance of catching that positive test. Mm-hmm. So I think in this case, I would say you could probably say with good confidence that you had COVID and base your decisions on that.
Yeah, there were kind of theoretical concerns about false positives with this throat swabbing, but from everything I've read, it's not an actual issue in practice. And there are several countries that did recommend it. Just the US was not wanting to, veer from the technical manufacturer specifications. But in Canada and in the UK, it was actually recommended. And UK Health Services had a video on how to do it. So actually I can drop that post because it had some directions on that. And I had a personal experience after reading that where I started to feel like I might have COVID because I think one of my kids had it. So I was closely monitoring and I started to feel a little tickle in my throat. And I tested and my throat was positive. My nose wasn't positive yet. In my case, my nasal swab did turn positive the next day, but I think that's a pretty common situation where the throat swab might turn positive a bit earlier. Right. But I'm surprised that the nasal never turned positive anyway. Mm-hmm. Yeah, I think if you have the combination of a positive test and you had symptoms, it's very clear.
Mm-hmm.
Yeah. So another question in this bucket is, I understand that we should wait 3 to 4 months for a new COVID vaccine after a COVID infection, but what if we don't know if we've had an infection? My young adult children don't test anymore, so they have no idea if they've recently had COVID. How should they think about timing their next vaccine?
So, a lot of these vaccine timing questions are kind of like a game of Price is Right. You're trying to wait as long as possible to get your fall vaccines without like going over or getting sick. And so, yeah, I mean, if you wait till November to get your shots, you didn't get sick, great, you won. You made it. But unfortunately, if you did get sick, right, not so great of a situation. So I think this all depends on your individual risk and how you feel, knowing that that's a situation that, yes, ideally you wait as long as possible, but you're risking getting sick and trying to figure out
Mhm.
what your risk tolerance is. But I think those at high risk probably shouldn't wait too long. If they weren't sure, maybe they should err on the side of caution and get theirs earlier. I think people at low risk have a little bit more wiggle room. Sometimes people like to think about the holidays, and you get that little, like, maybe 4, 6, 8 week window where you have kind of peak protection from infection. We know that protection from severe illness lasts a lot longer. But if you have that wiggle room, you might want to plan your shots around a wedding or a holiday,
Mhm.
or something like that. The CDC recommends that 3-month waiting period after the infection. Um, it's ideal, but kind of like what you're saying, Chana, is like these differences at this point, 4 years later, are so minimal
Mhm.
that it's really not worth overthinking. We have people that, kind of like an example, maybe you're sick, but you didn't test, or you tested negative, but it was really suspicious. Your kids were sick. Um, so I think it just more depends on risk. And if you have that wiggle room, great. But if you're a high risk person, chronic medical conditions, older adult, compromised, maybe err on the side of caution, get it earlier. You can always get that, like in the US, like Gail said, you can get that booster 6 months later.
Yeah, I just want to clarify, in case there's any confusion, that the reason that people are asking or suggesting a wait is not because it's unsafe. It's because there's a slightly better efficacy if you wait. But it is modest, and so there's no harm, right, to consider.
Right. We're all trying to life hack everything, and, perfectly safe, and you're going to get a great result. You win either way.
Mm-hmm, mm-hmm.
So we have some questions about Paxlovid and timing, some more timing questions, Chana. This one from Joanne says, at age 67, I got COVID in August and I took Paxlovid. I tested negative after 7 days. In this scenario, does an individual mount enough immune response to wait the recommended 3 months to get the updated COVID vaccine?
Mm-hmm.
I have not seen this addressed anywhere. I wish I knew if adults over 65 will be allowed another booster in 6 months. Well, now we know the answer to that.
Yeah, yeah. A couple of us nerdy girls were digging around trying to find data to answer this question, and there really isn't much. And so the bottom line is the recommendations are the same, whether or not you took antivirals. It shouldn't affect how you think about your weight. The only studies I could find on this, there was one study in mice that did suggest a somewhat blunted immune response in people who took antivirals. But there was also another study that was reassuring in humans, showing that people who got rebound after Paxlovid still had a fine immune response, so that it wasn't that this rebound that we see sometimes in people who do or do not take antivirals is not necessarily due to a poor immune response. So I would say the data on this are mixed, and I think it's sort of an attractive. I think that mouse study might have gotten a bit more traction than it deserved to get, just because it's sort of intriguing to consider. But at this point, the guidance is no different for people who did or did not take antivirals. And if this were my personal situation, that's also what I would recommend do personally, or recommend to those around me. I will drop some links to the studies in case anyone wants to read those. And this is, we're just about out of time. Perfect here. Gayle, can you finish us off with a discussion about vaccine access in kids? Because that's something that's come up pretty often. So Lynn, for example, asked, I have been trying to schedule COVID vaccines for my children, but CVS is saying they only have shots available for 12 and up. Are there pediatric shots not available yet? Or what's going on?
Yeah. Lynn, thanks so much for the question. So, unfortunately, we do know that COVID vaccines for kids under 12 are actually harder to find. Many pediatricians aren't actually stocking the vaccine. It's for a combination of different reasons. In part, the demand might not be there. And that doesn't mean that kids shouldn't get vaccinated. We really just need to find ways to get kids vaccinated and find those facilities that offer that. So there are retail pharmacies like CVS that do have COVID vaccines for kids, but it's usually only at select locations, and it might require a little bit of searching to figure out which locations have the pediatric doses and what ages they're willing to take. If you have internet access, you can usually find these locations through the pharmacy website and schedule that way. So they'll indicate whether that pharmacy has that pediatric dose or not. And, it could always be a good idea as well to give a call just in case. There are other options for getting your kids vaccinated, though. You can check with your local health department if they're holding any vaccine clinics and whether those vaccine clinics will allow children. Uh, Again, because they need to have that pediatric dose. And you can also search for other locations on vaccines.gov. So that's another great place to look.
All right.
When-
I've dropped those links, and I'm also going to drop one in for Canada, where I am. And I actually just got my notification that I'm eligible and my kids are eligible. So we'll be signing up to get our shot soon. So we need to wrap up here, but I wanted to give you both a chance to give any closing comments before we say goodbye for today.
I also, just as a note, had trouble at CVS. I'm not sure why they're not scheduling for kids when they have in the past. And I went to another retail pharmacy that I didn't have an issue. This was just last week.
Yeah, this seems to be a common issue.
And I think the last thing I would say
Closing
is
thoughts on this whole fall vaccine situation.
sure. The last thing I would probably say is that I know that we're always trying to, as Andrea said, find like that exact vaccine that works best for us. And sometimes, just with the way the situation can be, ultimately, I always believe that whatever vaccine is the best for you is the one that you have access to. And I know that answer doesn't always satisfy everyone, but a couple days of maybe feeling not so great is, I think, worth a whole chunk of time feeling protected from an illness.
Absolutely. Anything to say, Andrea, before we sign off?
I know. Yeah, I think you're right. These are all very questions with lots of different answers, but different facets. But at the end of the day, the best vaccine is the vaccine you can get, and we hope you all go out and get yours.
Mm-hmm. I hope you all got a taste of the fact that we are working diligently on the science behind all these questions, but a lot of these are just really hard to study in the real world. So we collectively, the scientists out there, we're doing the best we can to give you accurate answers, but sometimes good enough is good enough. And that's one of these cases. So thank you all for being here. And I encourage you all to keep up with Those Nerdy Girls content by signing up for our newsletter on Substack at thosenerdygirls.substack.com. And that if you have questions you want us to consider, either for a post or for a live Q&A, submit it to our website at thosenerdygirls.org. We don't respond directly to every single question, but we do read them all. And if you subscribe, if you become a paid subscriber, you will have access to a priority question box. So one final thing, if you have specific questions about your situation and that involves your health history, please talk to your healthcare provider. Thank you all for joining us. Stay safe and stay well.